As Nigeria joins global community to mark World Immunization Week 2026, stakeholders are calling for urgent action to close the widening immunization gap through improved financing and stronger accountability, noting that despite the life-saving benefits of vaccines, the country still has about 2.1 million zero-dose children, while immunization remains one of the most cost-effective ways to reduce child mortality and strengthen primary health care. Health Security Manager and System Manager Khadija Boboye and Senior Program Delivery Manager Amina Haladu of the African Health Budget Network made the call at the 2026 World Immunization Week press briefing in Abuja.
As Nigeria marks World Immunization Week 2026 under the theme "For Every Generation, Vaccines Work," the Africa Health Budget Network calls for urgent action to ensure that every child is reached with life-saving vaccines. Immunization remains one of the most cost-effective interventions for improving child survival and strengthening primary health care. In 2025, over 230 billion naira was allocated for immunization. However, only about 68 billion naira has been released.
In their recommendations, they urged the Federal Ministry of Finance, Budget and National Planning, alongside the Office of the Accountant General, to immediately release the outstanding 163 billion naira for immunization and establish a predictable funding framework.
We call on the Federal Ministry of Finance, Budget and National Planning and Office of the Accountant General to immediately release the outstanding 163 billion naira and establish a predictable disbursement framework for immunization financing. We also call on the National Assembly through Senate and House Committees on Health and Appropriations to operationalize the Lagos Declaration by strengthening oversight on immunization budget performances, releases and utilization. And then we call on the federal government to invest in local vaccine research and manufacturing capacity through NIPRD and PVAC and strengthen partnerships to strengthen long-term vaccine security.